So today I'm absolutely delighted to welcome, under the auspices of the Geary funding BICS scheme for 2024, Professor Rashmita Mistry, who's come to us from UCLA. So she's hosted by Vivian, who's in the School of Psychology. So just to introduce Professor Mistry first, she's a professor of education in the School of Education and Information Sciences at the University of California, Los Angeles. She received her doctorate in human development and family sciences from the University of Texas at Austin and completed postdoctoral training in Chapel Hill in North Carolina at the Center for Development Science. A development psychologist, her research centers on social class and race ethnicity as primary social context to children's developmental competencies. So she has three main areas of research. The first one focuses on family economic resources, child development. The second one focuses on how youth perceive, reason about, experience social and economic inequality, and the implications of this for their developing sense of self and attitudes about others. So focusing on intergroup relations in society. And a final line of inquiry seeks to better understand the socialization processes at home and at school that influence children's beliefs about social class, race, ethnicity, and social context. So today, Professor Mistry is going to be giving us a seminar on understanding families' experiences of poverty. And this is the results of a qualitative study exploring the perspectives of children and their parents. Though little is known about how those who experience poverty perceive, interpret, and understand their economic circumstances. To address this gap, Professor Mistry's qualitative study sought to understand family members' perspectives of their economic circumstances. So without further ado, I hand over to Professor Mistry, who will present the results. Thank you.
Thank you very much. I am delighted to be here. Thank you for attending the talk. It is my very first time in Ireland and in Dublin. And fortunately, I've been here for about a month in the UK. So this weather, I'm getting acclimated to it. And it actually feels like a nice break from conflict. So I just want to thank the Geary Center for sponsoring my visit, and Vivian and Laura for hosting me during my time here. And as was said, I'm going to share a little bit about a specific study that we recently concluded, but I was going to actually start with stepping back and thinking about some of the key questions that I look at and address in my work, specifically focused on social class and socioeconomic status. So as already mentioned, I'll go through this fairly quickly. My key questions are really kind of twofold. The first two really focus and center on how family economic resources either serve to support or disrupt family life and children's development. And within that work, I also have a particular focus on zeroing in and examining how children experience economic hardship and financial stress. So they're more kind of subjective experiences of this in their daily lives. In a related line of work, I also look at how children perceive and reason about poverty and wealth and economic inequality. And this is really work that's been done with children from quite diverse socioeconomic backgrounds, including some who have experienced poverty more directly. And then also related to that, I'm very interested in how children come to understand their own socioeconomic position and the attributions they make about it and how that may be related to their psychological well-being as well as their future educational aspirations. And then finally, as mentioned, as a developmental psychologist, I'm interested in how children come to understand these beliefs. And so specifically looking at socialization, thank you. So, echo, specifically looking at how they are socialized both at home by parents and others, but also some curriculum intervention work we've done with teachers in school settings to think about how we might better design curricula to talk with young children, especially about these concepts and ideas. And I think for me personally, a driving motivation in doing this work is that we know that young people today are being raised in a context of heightened economic inequality, which is also then correlated with reduced levels of social mobility. This is particularly true in the US, but I was curious about what this looks like in Ireland as well. And so you can see these are Gini coefficients. This is data from the World Bank. Gini coefficients, I imagine most of you in the room may be familiar with, but just in case, they range from a 0 to 1, 0 indicating kind of perfect equality, where everybody in a society has the same amount of income or the same amount of wealth. 1 would be where all of that income and wealth is really kind of held by a single individual. So these estimates for the US at about 0.4 are considered fairly high. And as you can see from this graph, these numbers have been persistently and stubbornly high for most of the past 50, 60 years or so, since the 1970s. The rate for Ireland is a little bit lower, 0.3. This is actually fairly comparable with other European countries. What's interesting is your rates have actually been declining somewhat over the course of the past 20 plus 30 years or so. Importantly, income inequality looks like this. If I showed you graphs on wealth inequality, it would actually look even more extreme than this. And one of the reasons that we worry about income inequality is because there's robust evidence now that living in societies and communities with higher levels of inequality are in fact related to lower levels of social mobility, greater resource divide. So we live in much more segregated neighborhoods, housing units, and our children attend schools that are increasingly more and more segregated. At an individual level, we also know that living in more unequal societies is related to worse physical and mental health and lower overall life expectancy as well. It's also related to lower levels of social and civic participation and lower levels of both institutional and interpersonal distrust, or lower levels of trust, higher levels of distrust. And then finally, one of the reasons that I pay particular attention to this is because we know that living in more unequal societies can also elevate our sense of status anxiety, which is a marker that's often associated with social class, and also status competition. It makes us feel like there are scarcer resources and therefore heightens our competition to gain access to those resources. In the US, these states and actually our beliefs around socioeconomic opportunity and meritocracy, which are related to inequality, also map onto our beliefs about poverty. And so in the US, as you may be already familiar, we have pretty strong beliefs around meritocracy. This is exemplified by things like our American dream, the idea that America is the land of promise and unbridled opportunity. If you are just willing to pull yourself up by your bootstraps, you too can achieve success in a society that at least the popular statement is that we are a classless society. I would argue against that, and then we really like to kind of hold up our individual stories of success as well. This is great. Meritocracy can be an important motivator and driver. Unfortunately, we also know that these beliefs then are correlated with how we actually view what it means to experience poverty in the US. So our attributions around poverty are often associated with individual responsibility. Therefore, if you have not achieved success, it must be due to your personal failings. They're also related to how we think about the role of the social contract and the role that the government plays in particular for assisting those that are more economically marginalized. And not surprisingly, higher rates of endorsement of these meritocratic beliefs are associated with lower or lesser endorsement of social policies, especially those programs to assist the low income. We also know that economic inequality matters for children's development. And in fact, part of the reason I start with that graph on, or that statement around opportunity and meritocracy, is when we look at who is more likely to experience poverty in a US setting, children are the largest subgroup of those experiencing poverty. So our rates in the US currently are about 1 in 6 American children were living in households that were officially designated as poor by the US Census. That equates to just under 11 million children in the US. And just as a point of comparison, I wanted to know what your rates look like here in Ireland. In Ireland, they're not that different in terms of percentages. So it's about 1 in 7 children, 190,000 children. I'm not going to talk about it right now, but I'm happy to answer questions about this later. It is important to know that this is using quite different metrics for definition. So ours is an absolute poverty measure, yours is a relative poverty measure, and I'm happy to talk more about that. We also know that poverty can be, it's not experienced equally. So we know that families with younger children, racial ethnic minoritized families, single parent households, really make a difference in experiences of poverty. In the US in particular, we know that documentation status is highly correlated. And we know both in Ireland and the US that experiences of poverty vary pretty substantially by geographic region as well. So while we know a lot about poverty, sorry, my slide is here, looks ahead. This is just kind of a summary of why we focus so much attention on this. There is literally decades of research showing us that experiencing poverty, especially in childhood, especially in early childhood, is particularly harmful for children's development across all developmental domains, including longer-term outcomes in adulthood. And this is just a summary from a National Academies of Science, Engineering, and Medicine report that just, I think, succinctly summarizes this. They say that a wealth of evidence suggests that the lack of adequate resources for families and children compromises these children's ability to grow and achieve adult success, hurting them and, importantly, hurting broader society. So while we know a lot about the ways in which poverty matters for children, we actually don't know as much about how children conceive of this, how they experience this, how they make meaning of these experiences, and the implications that this may have for their psychological well-being, as I mentioned, their academic and educational outcomes. So we know a little bit less about to what extent children are aware of their families' experiences of economic hardship, how they deal with it and experience it. And we also know for children whose families are experiencing economic hardship, we actually know very little about how these children then are mapping on their beliefs, their kind of broader beliefs about economic inequality, about wealth and poverty. Most of that literature in developmental science, and there is a healthy body of research here, most of what we know actually comes from research conducted with middle class and more affluent families. There's very little work that has actually been done with children experiencing economic hardship. Related to that, my interest in socialization, we actually don't know very much about how parents are communicating about social class in general, across families from all backgrounds. But in particular, we know quite very little about how within families that are experiencing economic hardship, how parents are communicating about their family's financial circumstances with children. There is a little bit of work, not surprisingly, that shows that parents worry about the impacts of material hardship. They try their best to shield children as much as possible from these experiences, and some of the mixed methods work that we've done in my lab has also shown that the parents will kind of sometimes go to pretty extreme means to try to provide their child a normal childhood as much as possible. There is a little bit of research that also shows that parents try to avoid these conversations, especially with very little very young children, mostly to try to protect them, to kind of prevent them from feeling embarrassed or worried about it. So this kind of backdrop was the backdrop that motivated this study. A little bit of interesting kind of side note about this work is that this study was actually motivated and launched by our federal agency, the Department of Health and Human Services. So they were interested in better understanding the population that they serve through the provision of the social safety net programs that they administer and implement. So through within the Department of Health and Human Services, the Administration for Children and Families is the kind of division that administers a lot of our social safety net programs, including TANF, which is our welfare cash assistance program, and others. So they actually contracted this study, and their primary motivation was to better understand what these perspectives look like from the perspective of parents and children directly. So the study itself had multiple parts. This particular part of the study had 4 broad questions that are identified here. How do parents and their families interact with public assistance offices and workers? How do they talk about their experience using public assistance benefits? What do parents think about how their economic circumstances and receipt of benefits affects their families and children? And what do children understand about their family's economic circumstances? For the interest of time and for today's talk, I'm just going to really zero in on our findings from these last 2 questions. So a little bit about the study design and analysis. The WHO, we were interested in sampling families experiencing poverty across the United States, which is a pretty large area to try to cover. But some of the key criteria for us, informed by where we know more or less work, was we wanted to make sure that we had samples that were in more rural communities as well as urban communities. Much of what we know about childhood poverty is actually centered around the experiences of children in more urban communities. We also wanted to systematically choose states across the US that had very different policy contexts. So in the US, we have federal policy and national policy, but our states have a lot of latitude in how to really kind of massage or kind of I'm blanking on a word, but how to manage those policies in a way that better serves their more localized constituents. So we get a lot of state variation, which is important to attend to. The participants were all recruited through contacts with local nonprofit organizations. These were all organizations that served communities and served families in those communities that were experiencing poverty. And there were screeners for eligibility. Participants had to be a parent or a legal guardian with at least one child between the ages of 7 and 17 living in the household. And then they had to meet one of these 4 criteria. This is kind of looking across both receipt of public benefits, work status, and then their perception of financially struggling and having a hard time making ends meet. A little bit more about the study communities. So we recruited from 2 metropolitan urban areas, and then, as I mentioned, 1 kind of more rural southern community. So it's New York City, Los Angeles, and then to protect our participants in that more rural community, we don't name the specific community or even the state. We just refer to it as South Central Appalachia. What you'll see scanning these numbers is that there was variability across these 3 sites, but importantly, rates of poverty, especially childhood poverty, were elevated across all 3 communities. We also have variability in terms of race, ethnicity, education level, and immigration status across these 3 sites. And our participants mirror this variability in the sense that almost all of our participants from our South Central Appalachia site were white. The majority of our participants from New York were either Black or African American or Latino. And then the majority of participants in Los Angeles were Latinx. In addition, across both New York and Los Angeles, about half of our participants were, in fact, immigrant households. And in LA in particular, we have participants that self-disclose their documentation status. It's not something we asked about specifically, but families talked about it. So, okay, a little bit more about the specifics. So we interviewed participants across 31 families, 35 parent interviews, 47 child interviews, roughly kind of equivalent numbers of children and adolescents. All of the interviews were semi-structured interviews that were conducted in the fall of 2019 and early winter of 2020. We had just concluded data collection when we went into lockdown for the pandemic. We were able to follow up with a handful of our participants about 6 months in to gauge kind of what their adjustment had been like during the pandemic. Our interviews were recorded and transcribed. They were all conducted in a location that the participant chose. So this could be in their home, or it could be at the local community organization based on their preference. We always had childcare providers available to help kind of manage other children in the household if we were doing these interviews in home in particular. A little bit about qualitative methods, and again, I'm going to run through this, but I'm happy to answer more specific questions. I know a number of you are interested in qualitative research in the room. We chose qualitative methods for this study in part because, as I mentioned, there actually is a lot less work in this area. So there wasn't enough for us to really think about doing a larger scale quantitative survey. Part of what we were interested in was really kind of documenting what these experiences look like, how participants are making meaning of their own experiences during the course of their daily lives, and then how they are interpreting these localized and embedded experiences. So our goal here is really around understanding and documentation, not around prediction or generalization. The semi-structured interviews for adults lasted between about 45 minutes to just over an hour. For the children, they varied. We actually had 2 separate sets of interviews, one for the younger children, one for the older children. So they varied between about 20 minutes up through an hour as well. They included both closed-ended and open-ended questions with probes and prompts built in so that we could really follow our participants' leads as they answered our primary questions. And then in terms of coding, we used what we refer to as an inductive pattern coding and analysis approach. This was a hybrid approach, both inductive and deductive coding. The process was that we first went through a procedure of identifying codes in our data, confirming the viability of those codes, and then looking across to assess some cross-cutting themes, which I will move to next. So in terms of key findings, for our first research question, so what are parents thinking about in terms of how their economic circumstances and receipt of benefits affects their families and children, we had 4 primary themes here. First, we found that many parents reported, not surprisingly, regularly experiencing some form of material hardship. We also found that parents, not so surprisingly, reported being worried about their inability to afford all of their needs, but in particular, they talked at length about their inability to afford all of their children's needs and wants. And in fact, children feature pretty prominently in parents' reports, specifically around kind of being able to afford their child to participate in activities and celebrations. We also found that parents were stressed and worried, but in the face of this, they also found ways to be resilient and resourceful. And then finally, parents considered very carefully when, how, and what they shared with their children about their family's economic circumstances. And so what I'll go through in the next few slides then is just to kind of give you a sense of what this looked like in participants' own words. So first, in terms of material hardship, as I said, many parents reported experiences of material hardship. I just wanted to give you a sense of what the prompts were that we asked parents about to initially start this conversation. And so this is a well-used measure of material hardship that looks across your inability to afford your family's basic needs in terms of housing, food, and medical care. What we find across the 3 sites is that there is variability. Their reports of material hardship were particularly acute when we were asking about rent, utilities, and phone service, and this is not surprisingly really about cell phone service and access. We find much lower rates of material hardship for food and medical insurance or medical needs, and that is partly connected to the public benefits that our participants reported receiving, which I'll share in a moment. So consequently, because of this material hardship, many parents reported feeling stressed and worried about their financial circumstances. So this is just a couple of quotes. So this is Araceli in LA. And she just talks about this constant, like, never-ending cycle of having to pay a bill, catching up on one, falling behind on another, and the stress that's induced by that. Erica talked specifically about experiences of food insecurity and noted that there have been times that she has gone hungry, but that she does try to attempt to make sure that her children always have access to enough food. And then Janet talks about the psychological consequences of kind of living in this constant state of trying to make ends meet. She mentions that she feels depressed. She often resorts to crying. And when she spirals, she often spirals in really thinking about, will this be the moment when her family is evicted and has to move into a shelter? So these worries, as I already mentioned, were particularly acute when parents were talking about meeting their children's needs. And I just want to give you a couple of examples of what that looked like in our data. So Gabriela, a parent of 2 in LA, talks about her child needing a computer for school, not to play games and such, but really that it was something that they considered not to be a luxury. It's something he needs to study and learn. But in order to acquire this computer, they knew they were going to have to take on more debt and the stress and worry that comes with that. In another example, Allison, a parent of 2 in South Central Appalachia, talked about a school trip. And this might be very unique to the UK, to the US, but at the end of middle school, a lot of children go on these big field trips where they're traveling kind of across the country. My son did the same trip to Washington, DC from LA when he was in 8th grade. But Allison talks about really just not being able to afford this, even with subsidies that had been provided with the school, and how that made her feel, in part because she really hoped that her daughter understood that if there was any way that she could make this possible, she would have made it happen. But as I said, in this context, we also see examples of resiliency and resourcefulness, which I think is important when we tell these stories and share these stories, right? So Paula, a parent of 2 in LA, talked about however she is able to manage it, she always tries to put a little bit of money aside for emergencies, because emergencies invariably happen. And even if it's just a little bit, whenever she has it available, she's trying to anticipate these kind of unnecessary outings or expenses. Carla, who was a parent of 5 and had infants, this was an interview that I did in her home in LA, I think speaks really kind of poignantly about how she manages basic necessities for her infant, right? So where she gets diapers and diaper wipes, but then also how strategic she is in using those wipes to ensure that she can make them last as long as possible before she's eligible to get some more from the community center. So in addition to kind of just trying to manage that resource pool, our participants did talk about using public benefits. And so this is just kind of a sampling of the more common benefits that they reported using. As I mentioned, TANF is our welfare cash assistance program in the US. There's low rates there. Those are not surprising given kind of what the policy context is around TANF. What you see, what's more interesting is the variability we see in our food assistance program, our health insurance program for low-income families and individuals, and the earned income tax credit, which is a form of an income supplement that we have for low-income families in the US. There you do see some site-specific variability. As I said, that is in part related to the differences in the policy context across these states. It is also in part, especially in LA, related to what you're eligible for if you are undocumented, because there are a lot of benefits that families are not going to be eligible for. In terms of kind of how they viewed these benefits, parents said that they were helpful. They were really essential to meeting some of these gaps and shortfalls in their budgets. But they were also aware of the stigma that's attached to receiving benefits. So Julie talks about being aware of what's said about people that receive food stamps and SNAP benefits, the assumption that you're not working to get these benefits, which maps onto some of those lay beliefs I mentioned at the beginning, and that, you know, she's embarrassed to be using them, and she is working. So it was always a tension between needing these benefits for survival, but then being mindful of kind of the associations and assumptions that are made for those that use them. And then finally, the parents tried to help teach their children about the importance of making thoughtful spending decisions, and then stepping back and being appreciative of what they have, despite the fact that their families are experiencing economic hardship. So just two quick quotes here, one from Gloria, who talks about being very intentional and strategic when they go shopping, helping her children to learn the importance of kind of checking prices, looking for coupons, seeing what's on special as a way to save money. And then Ramon, who was a parent in LA and actually was one of our undocumented parents, talks about really helping his children to focus and zero in on the privileges that are accorded to them because of their citizenship status in the US in particular. Okay, I'm going to pause for a minute before I turn to then what we learned from children and adolescents. And what we find is some parallels with what we were hearing from parents directly. So in terms of themes, we had several themes in our data here. The first is that children and adolescents were acutely aware that their families struggled financially, and also they were aware that their parents worried about being able to make ends meet, even though parents were trying to shield them from some of these experiences. Interestingly, neither children nor adolescents described their families as poor. They used terms like normal or average, but they avoided using that label, even though, as I said, these families were recruited because of their objective experiences of poverty in the US. And then finally, what we see is that children and adolescents' descriptions of wealth and poverty varied. But again, there was this tendency to really associate being in the middle or being middle class as the normative or the average kind of state. And that is very consistent with other work that we've done with children and adolescents as well. So a couple of quick examples of this. So first, as I mentioned, children knew that their families struggled financially. So this is a particularly poignant example from Ashley, who's age 15, talking about how she knows the exact date of the month when her father and her father's girlfriend, who lives with them, received their food stamps benefit. And then she also goes on to describe that there are periods during the month when her family does experience hunger, including her and her siblings, and then how they kind of manage to make it. Her grandmother, who also lives with them, usually has beans, is able to make cornbread, and that they just kind of sustain themselves on a very limited diet until the 13th of the month when they can go grocery shopping. Another example from Victoria, who recounted a time when her parents were struggling to pay the rent. And when the apartment manager came to kind of ask for it, her mom was not working at the time and they couldn't cover it on her dad's salary. So she was aware that her mom had to kind of get a loan from an aunt to address the stopgap until her mom was able to kind of get some work as well to fill that. They also knew that their parents worried about making ends meet. And this was evident even with some of our younger participants. So Orma in New York City talks about how she's clued into whenever her mom picks up extra work shifts. And she assumes that that is because money is tight. And so her mom is kind of using a strategy to generate a little bit more money. And then they, as I mentioned, they also worried themselves. They knew their parents worried, but they also worried themselves. And so Yvette in LA talks about how she does worry about her mom's work situation. She's aware and mindful that her mom's job might lose her job. And this has her concerned about how they are going to kind of live and manage their resources. And she worries that they may also kind of lose their home in the process. We also see, just as I said, parents were resilient and resourceful, and they also sought kind of very intentional ways to help their children understand how to better manage their resources. We find that this comes through in our child responses as well. So this can be like small things like Nicholas here, who talks about not asking for binders for school because he knows that they're meeting their kind of more basic needs takes a greater priority. But we also see it in other ways as well, including children who are refraining from asking for things themselves because they're mindful that they don't want to kind of be an extra burden to their parents. So Hector, who is one of our younger participants, talks about going to the grocery store and knowing that money is tight when his parents don't necessarily buy everything that's in their shopping basket when they get to the till. And how he himself sometimes will not ask for something if it looks expensive, right? Because he doesn't want to have his parents use their money in that way. And then finally, Gabrielle in New York talks about a time when she needed new basketball shoes to play basketball, but she chose not to ask her mom for it because she knew that money was tight at that point, right? So clearly kids are aware, and then they are also taking actions themselves to not be a burden to their parents. We also asked kids to rate themselves. We were interested in kind of how they perceive their family's rank and status. So this is an adaptation of a well-used subjective social status measure. Ratings of 1 indicate families with the least amount of money. Ratings of 10 at the top indicate families with the most amount of money. You'll see that there's variability in children's responses here. But on average, across both children and adolescents, their ratings kind of clustered right around those middle rungs between 4 and 6, right? We also asked them to describe why they placed themselves where they did. So this is where we get that indication that they're not actually seeing their families as objectively poor. They're using other kinds of descriptors and markers to really anchor their ratings. So Mackenzie in South Central Appalachia talks about knowing that her parents are saving up some money to buy a house, but she also describes her family as not poor, but not rich. They're kind of in the middle. Manuel in LA similarly says, well, we're not rich, but we're also not homeless. And he ranked himself around a 6. And then finally, Alejandra in LA described her family as having enough to like get by, that they're in an okay situation. And she did rank her family a little bit lower on the 3rd rung of the ladder. What's interesting about these quotes is they're all locally embedded, right? They're all kind of situated in their direct experiences and what they see around them. When we ask them to describe what it means to be rich and poor more generally, we see some kind of interesting differences. So first, Miriam and Michael really kind of focused on both traits of individuals as well as the kinds of stuff that people have. This is very typical of these kinds of questions when we ask them to children from broad, kind of diverse SES backgrounds. But we also see some more nuance. So Ashley here talked about, some rich people might be stuck up and selfish, but others are more generous and generative, right? So kind of getting into avoiding some of the black and white, but really talking a little bit about the variability within groups as well. In terms of what it means to be middle class, we found that our responses were a lot briefer. This is just one typical example from Bailey. You're not poor, you're not rich, you're in the middle. Here we actually found a number of our younger children didn't know what middle class was. So we had a lot of I don't knows, especially from the younger kiddos as well. We did, amongst some of our adolescents, have some really interesting, more nuanced perspectives, also kind of more locally situated. So Damien in New York talked about middle class as being a comfortable lifestyle, not having to worry whether you have enough money to do what you want. And then Anna basically was talking about an uncle of hers and said, being middle class means you can afford certain things, but you still have to be careful. You can't spend all your money at once. So you're still having to manage your resources. We also find that children and adolescents provided primarily what we call individualistic attributions for thinking about wealth and poverty. So this is shown here in responses by Jalen and Anna, right? And a particular emphasis and focus on effort and work effort as well. But again, we have fewer kids that actually mention structural attributions. Our adolescents, not surprisingly, were more likely to mention it. And I just wanted to share this one example from Ashley because I think it actually shows a level of awareness that we don't always see, right? So she talks about knowing that success and becoming wealthy can be attributed to work and having a good job. But then she also is mindful of her local community and the fact that kind of well-paying jobs are much harder to kind of get where they live, and that you have to travel a lot further to receive them or to get to them. Just a couple of quick takeaways. So again, I think it is important to kind of state what the motivator for this work is, because I think that signals what ACF and HHS are also interested in and attending to. And in a US context, I think it is really important to be mindful of who these programs serve and what we know and understand about what those daily lives and lived experiences look for, hopefully to better inform the way in which we do service delivery and program benefits. Our findings do highlight that benefits are essential to helping these parents make ends meet, but nevertheless, they're not sufficient. And so they are struggling between benefit use and earned income to make ends meet, but they find ways to be resourceful in doing that. I think, again, what's more unique about this is the data we have from children directly and hearing from their voices, right? So even the youngest children in our study were aware that their families are experiencing kind of financial stress. They're aware that their parents worry about this, and they also are taking on strategies to try to lessen this burden for their families directly. Interestingly, when we ask them about their broader perceptions of wealth, poverty, and inequality, their responses don't look that different from the host of studies that are already out there. I think that is a little bit telling about what our broader discourse and narrative is in the US about kind of inequality and about who can make it and who struggles to make it. The fact that children whose families are directly experiencing this are kind of tuning into that larger macro discourse from an early age, I think is worth exploring further and thinking about what the implications of that might be. Okay. And with that, I'm going to stop. So thank you.